What is scabies?
Do scabies mites live in dirt or mud?
What is a scabies-free zone?
Does the sun kill scabies mites?
How does a person get crusted scabies? I might tell you. What is a scabies-free zone?
So a scabies-free zone is,
A zone that is scabies-free.
Yeah, there's no scabies there.
Yeah.
It is about having, so at the individual level, a scabies-free zone is about making sure that you've got no scabies on your body. So that's about making sure you've used your medications a week apart and got rid of the scabies.
Yeah.
At a household level, it's about making sure that the whole house is a scabies-free zone, that everyone's been treated, and that if visitors come in, you treat those visitors for scabies if they have it before the household can get a cycle of transmission going. And I mean, you can expand a scabies-free zone right out to the community or the region.
It's kind of more looking at doing a mass drug administration or something like that in terms of getting rid of all the scabies in those communities or places. But
Yeah, more big health promotion events to do that sort of work.
Yeah. But definitely, maintaining a scabies-free zone at home just means being aware of your skin, you know, looking at your family. If your family's itching, kind of knowing, okay, like, you need to get that treated or that kind of stuff. It's just, being really aware.
Yeah.
And it's really important with crusted scabies clients living in households, so people who have historical episodes of crusted scabies, it's really important that they are maintaining a scabies-free zone at home so that they don't have the risk of going back to hospital with crusted scabies again. Yeah. So it's a big message that we send out, maintaining a scabies-free zone.
Yeah. So that regional level thing about having a scabies-free zone, those health promotion events is about having things like healthy skin days or healthy skin weeks where the community can really get around learning about what scabies is and maybe sometimes doing a whole community treatment day and then repeating that again in a week's time for anyone who had scabies, about trying to make that whole area a scabies-free zone so that anyone in there is safe from scabies and maybe from developing crusted scabies. How is simple scabies treated?
So, simple scabies, there's 3 main treatments for simple scabies on a human body. Medications, yeah. The first and most common is Lyclia cream, which is 5% permethrin. And Lyclia cream is applied from head to toe, all over the body, underneath fingernails, toenails, in between fingers, behind your ears, all over your face, just, you know, not obviously in your eyes and mucous membranes. For babies, same thing, you know, not on the hands, and again, not on the mucous membranes or in the eyes.
But that lotion, so either benzoate is applied in a similar way, that's a lotion. Those 2 need to be left on overnight before being washed off the next day.
And there's also, ivermectin, which is the oral tablet, which is used to treat crusted scabies as well. I guess with treating simple scabies, 2 doses, 1 week apart of either Lyclia, ivermectin or benzoate.
Yeah, that's because the first dose will kill the adult mites, but then they can't kill the eggs that might be in the skin. So those eggs can then hatch a few days later, and you want to use that second dose a week later to kill any eggs that have hatched before they can reproduce again. And also treating the household all at the same time.
Yeah, everyone at the same time.
Yeah, treating everyone at the same time will stop the cycle of transmission within the household and will help to stop those recurrent scabies cases.
How is crusted scabies treated, Hannah?
Crusted scabies is treated in hospital. That should be the first sort of thing that comes to mind. There are some cases of a grade 1 scabies that can be treated in community, but crusted scabies in general is a much more cumbersome disease to treat because the medication regime is much more difficult. It requires isolation stays a lot of the time in hospital. So that's really about getting that person under the care of infectious diseases or dermatology within a hospital setting so that more intensive care can be provided to that person It's treated with topical scabicides, it's treated with oral scabicides at the same time, and it's also treated with skin softening creams, lactic acid and urea. So that on alternating days, the scabicide treatment is applied to the whole body. That's left on overnight. The next day, a shower, wash everything off, and then the skin softening cream is put on areas where the skin is crusted. The idea of that is that the next morning, that is like gently scrubbed off as much as possible in the shower, so that the next dose of scabicide medication can actually get into that and start killing the mites that are underneath.
Yeah.
So it's quite an intensive process, and that's why it's recommended that all cases are treated in hospital, because it's a very difficult thing to ensure that that person's not being exposed to scabies during their treatment, and they're not exposing a household to scabies during their treatment as well.
And yeah, like you were saying, it is an intensive treatment. You're putting creams all over someone's body. And, you know, if you've got a client from a remote community and they're coming into hospital, that's really hard to do at home because there may not be a lot of privacy.
Yeah.
And, you know, having a nurse there to actually help with putting those creams on, and being in the hospital setting, you know, makes it a much more successful treatment.
Also, the hospital is used to treating crusted scabies clients, so it's just like they've got their guidelines and their processes that make treating crusted scabies easier for them as well.
Yeah. What medications kill scabies? Okay.
So there's 3 medications currently. So one of them, the most common one, is Lyclia, which is 5% permethrin cream. That's a lotion that's applied from head to toe, absolutely everywhere, underneath your fingernails, between your fingers, armpits, groin, everywhere except the mucous membranes. And that's for, everyone can use Lyclia. It needs to be left on for 8 hours. There's another topical medication called benzoyl benzoate, and that is a lotion that's applied in the same way and left for the same amount of time.
And there's also ivermectin, which is an oral tablet, which is prescribed by a doctor.
Yeah.
And does the same thing, kills the scabies mite, but just an oral tablet.
Yeah, but you can't use ivermectin for under 15 kilos, under 5 years.
And pregnant.
And breastfeeding mothers.
Yeah.
So that one's a little bit more limited in who can use it. But all of those medications require 2 doses.
Yeah.
None of them can kill the scabies eggs, so you have to use them a week apart.
Yeah.
So that you kill any scabies mites that might have hatched after the first dose.
Yeah. So key to take away, 2 doses, 1 week apart. And that kills the adults and then the eggs that have then hatched and turned into adults.
Yep. Why do some people seem to get scabies repeatedly? We hear this one a lot.
Yeah, we do hear this a lot. I suppose there's a lot of levels to that answer for that question.
The biggest one is, did the treatment work?
And was everyone treated?
Yeah.
Would be like the main one, I suppose. You know, if someone comes back recurrently with simple scabies, you'd want to be checking, you know, has everyone in the house been treated?
Have they taken the second dose?
Yeah, have they had the second dose as well is a really common one. You know, people will have the first dose, then they'll be fine, and then come back again, and because they haven't done that second dose.
Yeah.
I guess it can also, you know, be about a housing situation. If you're having a really overcrowded household, it may be a scabies.
A lot of visitors.
Yeah, it may be a scabies-free zone with just your family, but if you've got visitors coming for, you know, multiple different reasons, and they've got scabies, it may feel like, you know, that you're repeatedly getting it from visitors and not everyone being treated.
Yeah.
Yeah, so the crusted scabies is more infectious because of the mite load, and so they're, you know, shedding mites into the environment.
They just get so many of them that they start actively shedding off the body. And then, you know, there might be mites on a table or a chair, which doesn't happen with simple scabies.
It doesn't happen with simple scabies. So it's really easy when it comes to crusted, it kind of goes from being that prolonged skin-to-skin contact where you've now got flakes of skin in the environment, and so
infected foam mites, you know.
Yeah, so babies crawling around, getting scabies off the ground and that kind of stuff.
Yeah. So they still come off with a bit of skin, and they might survive a little bit longer because they've got a bit of skin to eat. But they're only coming off the body because the skin's flaking off the body. They still don't want to. They're
not choosing to leave the body. They're just
being physically removed.
Yeah. My client has received treatment, which I believe was effective, but they are still itchy. Why?
So that's really just about the fact that after you've treated scabies, you could still be itchy for a couple of weeks. And that's just because I think the body is still sort of thinking that there might be something in there still. So even if treatment has been effective, you might still be a bit itchy, and that can sort of just be managed with like Urax or some antihistamines, which might help with the itch. If they were still itchy, like after a few more weeks, or if they're getting new papules, like scabies papules, then you'd probably consider retreating.
Yeah, retreating and making sure that you're treating everyone in the household as well.
Yeah.
How should scabies cream or lotion be applied?
Well, it's written on the box, but
I think it's important to note all over.
All over the body.
Not just where you're itchy.
Yeah.
Yeah, or not just where there's papules. Yeah, definitely head to toe, not in the mucous membranes. For babies, not on the hands, obviously, in their mouths all the time. Yeah, head to toe, behind the ears, anywhere. Yeah. Because the scabies can be anywhere on your body, regardless of where you are itching.
So the Lyclia will say on the instructions to apply from the neck down, but a lot of guidelines pertaining to high-risk populations say that covering the face and the scalp with Lyclia as well is really beneficial for those high-risk settings. So avoiding obviously nose, mouth, eyes, applying to the face and the scalp will also really help to sort of treat scabies in those high-risk settings. Yeah.
Or if you're worried about a really serious case of simple scabies.
Yeah. Yeah. Can crusted scabies be cured?
No, it cannot be cured. So a person can be diagnosed with crusted scabies, they can be treated, and that treatment can be successful. However, that person will always be at risk of getting crusted scabies again.
Yep.
So as long as they are at risk of getting simple scabies, an individual is at risk of getting crusted scabies.
Yeah. So that's really why it's so important to have crusted scabies crusted scabies clients on long-term management care plans, because the reasons for treating their crusted scabies for developing crusted scabies in the first place hasn't been treated when actually just treating the crusted scabies. So if they had kidney disease and that caused their immune function to be lower, and that's what caused their crusted scabies, getting rid of the crusted scabies obviously isn't treating the renal condition. So if they get scabies again in the future, they can always develop crusted scabies again. So if they're on a long-term care plan and you're looking for scabies in them regularly, you can identify a case of scabies, treat it before it turns into crusted scabies and they need to be hospitalised again. So yeah, that's just that, like they can't be cured, but they can be managed really well. So they might not ever have another recurrence if they're managed well.
Yeah. My client has sores and scabies. Should I wait for sores to heal before treating for scabies?
A lot of people ask this. They might have a child come in, they've got sores all over them, and they're like, oh, I don't want to put Lyclia in the sores. So at the moment, CARPA does say that you can treat both at the same time. If you go and treat the sores, but you don't treat the scabies, you're not treating the reason why the sores developed in the first place. Yeah. So you're going to need to treat, ideally, both at the same time so that you're getting on top of both of them at the same time. You're treating the cause of infection when you're treating the sores, but then you're also treating the reason why those sores initially, the reason why the skin was broken in the first place by treating the scabies. Yeah. So Lyclia can be applied to sores, but just, use discretion. Like if it's a big open wound.
Big open weeping wound.
You're not going to be wanting to put Lyclia in that, and neither is the client's not going to want you to be doing that either. Yeah. If in doubt, always refer to CARPA.
Always refer to CARPA.
Yep.
But,
Yes, you can treat both at the same time.
The answer is yes.